Hello and welcome to another episode of Scott Schilling Speaks. I'm your host, Scott Schilling, and we want this time together to be tremendously educational because it's on an amazing topic that's forefront in many people's minds today, healthcare and healthcare costs. So our guest today, Dr. David Berg from Redirect Health. David, thanks for being here today.
Hi, Scott.
Just really looking forward
Yeah.
to our conversation. So you guys have not kind of, you have changed the way people have the opportunity to think about healthcare these days. How have you done that?
Oh man, everybody wants to jump into the how, and that's a hard question to distill what we've done in 25 years in that one question. But let me start with the why. Maybe that will make it easier for people to understand the how, because I can go into how at any level of granularity that you choose to want to go into.
I love the why. The why is always important. So I
So
actually probably should have asked that.
when my wife and I, both physicians, moved here from, I trained as a chiropractor. My wife is a primary care physician. We moved here from Toronto in 1995. We started a business, started a practice, and we just really had trouble getting the math to work in the healthcare system for our own employees. And so we needed to build something, and we thought we could just figure out the insurance better. But every time we looked, the deductibles or the out of pockets were higher than our employees could afford, even if we paid all the insurance. Now, it's back in those days, the early days, the deductibles were only $250, $500. Then they went to $1,000. Then they went to $1,500. But most of my employees didn't have $500 in the bank. So even if I paid for the insurance, they couldn't afford it. And as I started not being able to afford the entire premium, they had no extra money after paying rent and childcare and food and transportation, car payments. There's just no extra money. So coming from Canada, we had this mindset that maybe was off a little bit. It was definitely different, where we thought that healthcare had to be simple, it had to be affordable, it had to be for everyone in the family, everyone in the business. And that was just how we grew up in Canada. And I'm not saying the Canadian healthcare system is better. It's got many problems. Matter of fact, I think the US healthcare is much better, but we make it really hard to access it for people. And mainly it's because of cost. So we had to solve that. And I spent 10 years trying to solve it in the traditional world, and we just couldn't. So why did I do it? Because I had to do it in order to make it make sense, make the math work for my own employees, my own company, and the families that we felt responsible to. And so we had to make it simple, affordable, had to be for everybody. And here's the other thing too. I wanted to know what it was going to cost next year. So as I was rebuilding the system, I wanted to know what it was going to cost next year. I want to have a reasonable chance of guessing at least. And sometimes it's 23%. That's not good enough. Sometimes it's 12%. That's not good enough. I wanted to know that it wasn't going to go up next year if I could make that happen. And we've been successful at all those things for our own employees, but now for many around the country, many clients around the country, and many friends companies too. But that's why we did it, is because we needed something simpler to understand for our people. We need something affordable for us and for our people and our families. And we thought, and we still do today, that we have incredible business advantage around recruiting, retention, if we can take care of everyone in the family. We don't just make it affordable for the employee and then they can't afford their kids. Ugh. I mean, I can't even fathom what that must feel like as a father, to have to be in that situation where I get healthcare but my kids don't. So we've solved those problems for ourselves, and we know what it's going to cost next year. Matter of fact, we've probably gone overboard on that. I spend less money today than I spent 20 years ago on healthcare, and I get more healthcare for my people because we created a system that really eliminates the unnecessary activity in healthcare and the unnecessary spending in healthcare. And when I say activity, I don't mean just get rid of an MRI. I mean, get rid of the paperwork for that MRI. Get rid of the copay and the accounting for that copay by having the copay zero. And maybe you don't need the MRI, so we will eliminate it, but we might replace it with a $28 X-ray. So we've built the whole system around small businesses or purchasers of healthcare and their employees or the users of healthcare. And the whole system has to point towards those two groups working together to get a common benefit. So that's why we did it. And I know it might sound a little philosophical, but I'm happy to jump into what we built and how we make what we built work as well.
Well, I think that the philosophical is great because I think that that healthcare is a number one, we all need it, but the other side of it is that so many people don't understand it and don't understand the system, and the rules and everything keep on changing so dramatically, and then you hear of ridiculous amounts of money for certain process. I had my sister-in-law recently was in, had some things done, and the numbers that she was saying for the tests that were running, the different things, oh my goodness. I mean, crazy numbers along the way. And so those are all the things that you've
And
addressed in
those are the big things,
redirect
but
system, right?
what about the low cost things that are high volume? Right. So that we're always going to have that, that brain surgery or that cancer. Those are low volume things, but the cost can be astronomical. I mean, if you do, you have a heart attack and you know your way around the system, you might get that whole thing taken care of with stents and all the bills for $20,000. You don't know what you're doing, you could get $220,000 for the exact same care. So there's huge differentials in those big things. But one of the things that we've learned in order to make our system work better is we got to be able to take care of the high volume things that where the differentials big, but the difference between $5 and 100 and I'll give you an example. We're just looking at one of our members, and he actually works for me, so I know a little more detail than I might know about a regular member. But a statin at a certain pharmacy is $173. A statin is a generic drug, and for I won't go into what it's for, but $173 at this pharmacy, which is a nationwide pharmacy. However, at the grocery store, it's $5.69. $5.69
Something doesn't seem right there.
or 173. Now, the only thing you have to do is switch the place of service. Don't go to that pharmacy, go to the grocery store across the street. And that's the differential. So if you add that up times thousands of occurrences every month, that's where the real savings happens, and the predictable savings happens is just by beforehand or afterwards redirecting people, hence the name Redirect Health, to the smarter option. We always want people to get the right care. We also want them to get the right timing, the right urgency, but the right price. That statin, the right price is $5.69. Nobody's going to be able to put any argument that I'm going to accept that says, in any circumstance, can that statin be $173? But it is all over the country because people don't know and don't have transparency, and the purchasers are kept blind because the business owners are paying for it. The employees are paying a portion, but much less. So everything we built in our system is about aligning the incentives of purchaser and user, employer and employee. If we can align the incentives and working together, the power shifts away from the vendors in healthcare, the hospital systems, the insurance companies, the drug companies, the pharmacy benefit managers. It keeps going. Distributors of drugs and supplies, device companies. The power shifts over back to the purchaser and user when they work together. So we created a system that makes it where all the incentives are aligned for the purchaser and the user and us to work together to not to hurt the vendors, but to make sure the control stays where we want it to stay, which is the purchaser and user of healthcare. We want the control to be there. We built a system that gives them control. And then we make sure we treat the vendors very, very fairly. But you know what's fair for that statin? $5.69.
Yeah.
That's fair. And for an MRI, what's fair? $300, maybe $400, maybe $500, depending on the region of the country. What's not fair ever is $1,500 for an MRI, or $3,000 for an MRI, or $8,000 for an MRI. That's just not fair. Babies, what's fair? Normal delivery, $3,000, $7,000, depending on area of the country. That's fair. What's not fair? That same baby, no complications, $30,000 or $40,000 in the exact same hospital with the exact same doctors. So that's how we think about our system. It's about getting people the right care and then at the right price also.
Well, I think it makes a tremendous amount of sense because obviously if you can, as an employer, you can offer healthcare to your employee, you're going to have a more loyal employee. They're going to stick around, but they're also going to show up for work because they're healthy. If it becomes affordable and becomes in, with a program like yours that really allows them, if they need it, great. If they don't, great. But the point is they then have it behind, they have the comfort behind it, right? And then that becomes so important. I would think, I mean, what just popped into my head is the reduction of stress, knowing that you have that support too, right?
Well, that's a cost. So we talk about how we want to eliminate unnecessary activity and unnecessary spending or unnecessary costs. But cost, we break it up into the cost of money, the cost of time, the cost of frustration and stress and attention and thinking. Like those are all costs. I would much rather that a family is thinking about their next vacation or their kid's soccer game or how they're going to advance their careers and advance their place in life. Like that's where they need to be spending their attention. I don't want them spending their attention on, oh, I got to make a doctor's appointment. How much time do I have to miss from work? And do I have that time? And who's going to pick up the kids from school? And like all the other stuff, the time sucks that healthcare just everyone takes for granted. There's gonna be a time suck. And we said in our system, no, let's get rid of that cost also. And
That's awesome.
yeah, and so we think about it at that granular level. And so far, we've just been talking about the philosophy of what we do and the requirements of the system. But I believe that I could show anybody how to do it if they wanted to, and I believe I could show any American business who wants it, any American business, how to have their healthcare work so well, so inexpensively, so easily, so simply that they could give it to their employees for free and have there be no cost to their employees, and they would benefit from it because of the business advantage, free market business advantages they'd create for themselves, whether it's less recruiting costs, less retention costs, retraining costs, the productivity gains, absenteeism that would go down, just people who will buy, being able to have a larger candidate pool, people who will buy into the company's mission and align with the company's core values, all of which drives productivity and enjoyment in the company. Those are all free market reasons why an employer, if they knew how, should want to make healthcare free. And forget the healthcare free. It's really about being a place where people can go that will remove the burden and the cost of that attention that they currently place on healthcare. Any business can do this in America today. There's no reason that some kid from Canada can come over here and do it and nobody else can do it too. I know anyone can do it. And my employees haven't paid a dime for healthcare. I pay all the premiums, all the deductibles, all the co-pays. They have to be in my system though, and they get all the care they need. We have cancers, we have babies, we have everything you can imagine. And the total cost is less today than it was 20 years ago for me as an employer. And my employees do nothing.
That part's phenomenal.
And that means that I can give all my employees free healthcare. They don't pay anything. It's not free. Somebody's got to pay for it, but they don't have to pay for it. I can remove that burden from them because my cost is probably about 20% of what it would cost my competitor. So last year, put in real numbers, we gave our employees what would have cost in the open market, probably about $3.5 million of healthcare and insurance and the whole thing, soup to nuts. Well, 3.5, 3.4 million is what the actuaries tell us it should have cost. It cost us $900,000 to do it. And that's with a company with about 450 people, probably close to 500 people on the plan. Say 450 people on the plan. That's about $2,000 a person per year. So think about if I can offer the healthcare to my people that less expensively. Think of the competitive advantage that I've given our company when it comes to recruiting and attracting and retaining the very best people. I mean, the people aligned with our core values. They have a heart for our mission. I don't just mean they can recite it. I mean, they care about it because they're experiencing that mission themselves for their own families. And it just allows us where if we didn't have this, if I had to pay 3.5 million for that healthcare, I might be able to get the same thing, but I don't have 3.5 million to budget for healthcare, but I do have 900. And I can do that because those people I attract are so good, Scott, that they create a productivity level that pays for that healthcare. So it's a complete closed loop system where the beneficiaries of the healthcare are supplying their energy in order to keep the benefit there. And we work together as a team. The employees do, my managers, our directors, me, we work together as a team. And we don't, I mean, we treat it like sport to some degree, but it's the beginning we're doctors and we want to care for people. We want to take care of people. We want to make sure people get the care. And the more money we free up, that money can be used to take care of everyone. And any business in America right now could do this if they knew just what are the drivers in healthcare and they just applied some simple strategies. Quite frankly, I have solved many more business problems in my business that were harder than healthcare.
And I would
day.
think that many people would say, oh, come on, that's not possible. You know, the healthcare issue is the number one issue in the country, and it's, you know, we're just up against it as a business.
Yeah.
And you're saying, oh no.
Yeah, I'll tell you, here's the number one mistake that business owners make. They don't want it. It seems so complicated, and they feel like they get beat up on healthcare that the CEOs of our country don't want to tackle healthcare. That's what it comes down to. When I for 10 years as a CEO of my company, I didn't want to tackle. I handed off to an HR manager, an office manager, and a broker, and they worked on it. And I got disappointed every year, and I didn't think I could make any difference if I participated in it. When I realized, and this is more true today than it was when I realized it 15 years ago. 2007 is when I realized it, 14 years ago. But it's a team approach. In every company, if you're not doing this, you are spending probably double what you should on healthcare. Right. At least 25, 30% more than you should in healthcare. If you're not doing this one move. The HR person's responsibility, the office manager's responsibility in any size company should be to communicate the health plan to the people and help them use it optimally. That's it. He or she should not be the one in charge of the money and the budgeting. That's the CFO's job. It's the controller's job, the accountant's job. Let them make sure you don't run out of money, that you can afford what you're doing. But the thing that's missing still is the strategy. That's the CEO's job, the strategy. What are you trying to do with your health plan? So the CEO would never hand the responsibility over to an HR manager or a CFO to go find me a building that strategically gives me a competitive advantage and then pay the rent. They wouldn't do that. The CEO should be in charge of strategy for healthcare, just like they're in charge of strategy for everything else that goes on in that business. So I like the CEOs owning strategy. For every dollar of healthcare we're going to spend, what are we trying to get out of it? So maybe I'm a CEO and I'm trying to lower my workers' comp costs. How I contribute to my health plan and how I set up my health plan will be a little different if I'm trying to lower my workers' comp costs. If I'm trying to grow my business and attract a lot of good talent, I'm going to contribute a little differently. And there's so many different ways that an employer could contribute strategically. Most of them don't. They just do, what does the insurance company tell me I have to contribute? I have to pay 50% minimum of the employee, so that's what I'll do. There's nothing strategically about paying 50% or 75% or 100% for your employee, but now paying nothing for the family or not having something in place. So I'm just saying, be strategic CEOs. That's your role. Make sure your controller, your CFOs are telling you have enough money to do what you want with your strategy, and make sure you have an HR person who understands what your strategy is and what your plan is, so that they can communicate it well to your people. A great plan is not communicated, is not that useful. Right. A great plan you can't afford is not that useful. A great plan you can't afford does not communicate is not that useful. So there's a very important triad there. And when these three people in a company, sometimes it's just one CEO turning the hat around because they're going to wear all of them. But you've got to think that way. And you got to think strategically. You got to make sure the money works. You got to make sure it's communicated. And any company does that today. And that's what we help companies do. We build a system where we help them do that strategically, and then we execute the healthcare piece for them.
So is there a perfect business? Is there a perfect size of, where does this optimize? Where does Redirect Health optimize the very best?
So we've seen really big groups that do what I just told you poorly with the three people. And I've seen really big groups that do it expertly. And I've seen really little groups do that perfectly. Maybe the same guy with the same hat, but very strategic. But it really comes down to leadership. And it could be any one of those leaders that take the lead, the HR person that says, CEO, it's your job to do strategy. Stop trying to make me do it. You decide. That's a great HR person. or the CFO that says, hey, I'm going to make sure we don't run out of money, but CEO, you're in charge of strategy. And usually it's one of those two parties making the CEO be responsible for strategy. That's a great client for us. When the CEO wants to take a back seat and does not want to be in charge of healthcare strategy and getting a return on that healthcare spend, that's a terrible client for us. That's somebody who's just looking for a lower cost. They're not really looking to get a return on what they spent.
Right.
So we see that much more now because of that. The range that seems to get that perfect triad for us of leadership tends to be in the let's say the 20 to 500 employee range. We've got some employers bigger, we got many smaller, but that's where they're big enough where they start to have multiple people.
So obviously you know, there are always new companies coming on board and that you're always working with. What kind of reductions are they experiencing? And then the other side of it is how much better is the care that their employees are receiving? Kind of a two-part question, right?
Yeah, definitely. So let me, how do I want to answer that? Okay, so let me answer with how we built it, Vix. I think it'll answer the question. So, and I'll start at the end, and then I'll come to the beginning and I'll fill in any gaps that you think I've left there. But we created our own mutual insurance company. We created it, and with the rules that made sense for the purchaser and the user. And we created it as a mutual insurance company, which means the policyholders own it. It's for the benefit of the policyholders, not for the benefit of shareholders or anybody else. So I don't own the mutual insurance company. The policyholders essentially do.
Right.
And that means that any money left over is there for the benefit of the policyholders, which keeps prices down and to pay claims. So if there's money left over, it means that prices don't have to go up next year. And that's my goal. When I created that mutual insurance company, I picked the price. My assessment of the market was that employers, in order to be able to pay for all of it, I had to stay under $400. If I went above $400, it was really just for bigger corporations. But I wanted to do this for the smaller businesses in America. That's where this fits. That's what it was designed for, like companies like mine. And so I just picked a price of $379 because I wanted to stay under $399. That's how I picked it. And then I worked with the actuaries to figure out what benefits could we squeeze in there. We squeezed a lot of benefits under there. And we had to exclude some things, but we had to have other solutions for the things we excluded. So we purposely excluded some things that are very low volume, often less than 0.1% incidence, but the cost can be 30, 40% of the plan sometimes.
Wow.
And we want to make sure that there's an alternative way to get that care, whether it's through qualifying federal programs or state programs or manufacturer assistance programs. There's many different ways to pay for healthcare. And we wanted to make, that was really our scorecard for the things we would allow to be excluded. What that meant is we weren't going to exclude preemie babies, weren't going to exclude cancers. Those things we had to leave them in there. But there were some things like skilled nursing. Most people in skilled nursing are disabled and they qualify for the Medicare disability program. Don't have that in the health plan. Unless you can afford $600 a month. But for our clients, I picked $379. So we excluded some things that were very low volume, very high cost, that we had alternative ways to pay for. And we made it so we could sell that in all 50 states. In order to do that, we had to operate under the federal ERISA law. And then we got 50 licenses to be a third-party administrator so that we could pay for those claims and work with the health plan and with the businesses. And then, of course, we had medical licenses in all 50 states also. So because we have medical licenses in all 50 states, we can take care of people and do their health care, and we can collaborate really well with doctors and hospitals all over the country, labs, x-ray, and we're good at it because we're doctors. And then, but we could also administer the claims for the test and for the treatment that we were ordering, which gave us a huge advantage. So there were less claims because we're ordering them, or there were smarter claims because we're ordering them. That statin is $5.69, not 173, because we're ordering it at the right place. So because we control the entire healthcare journey, and that's how we think about it, we can eliminate a lot of unnecessary activity, unnecessary spending, and just unnecessary attention having to be placed on that journey. So we created this integrated model that we have a mutual insurance company, third party that can, for the benefit of keeping costs down and for the benefit of costs not going up for the employer. And then we create TPA in all 50 states so that we can administer the claims. And then we have medical licenses so that we can order the services that are needed. And in the beginning, we're just doctors. And where we have some advantages are we started as doctors and as business owners. And truthfully, I started as a doctor, but to really do this, I had to stop being a doctor. When I was trying to be a doctor and be an engineer, be a doctor and be a business person, I struggled with it. And it's the rare doctor that can really be an engineer of a system and a business owner and a business person, an entrepreneur. It's a rare doctor. And I don't even know you really want them to be your doctor. If they're tinkering with the system all the time. Right. So for me to really do this for my own company, I had to stop practicing. I had to stop being a doctor and just let it go. Just let that part of my life go. My wife still does a lot of doctoring, but I don't, and I haven't since 2001. And I've tried to involve other doctors in the engineering of it, and it's hard because the mindset's so different between being a doctor where you've got to be perfect everywhere, you're afraid of getting sued, to being an engineer or a business person where you can tinker with things and you can model things and you can test them and then you can change it a little bit after you learn something, right? So it's really hard to do tests when you're a doctor. Well, let's see if this pill works. That doesn't work really well.
Not the way it works.
Versus when I'm trying to create an enrollment system, make it easier for an employer to sign up. Hey, let's try this. Let's see if this makes it easier. Oh gosh, that made it a little harder. Stop doing that. We can do that very easily in the system part. And we've done a really good job, I believe, of separating the clinical care that my wife, Dr. Janice Johnson, oversees from the rest of the business and the engineering of this whole system, which is what I oversee.
I mean, I really think it's fascinating. It's a fascinating story, number one, how it came about and the why it came about and everything there. But the reality that you can be of service to so many more organizations, that you've now created a system that's been running for many, many years, very successfully in serving your clientele, serving the businesses and the patients and everybody so well. How come more people aren't jumping all over it?
Nowhere in there did I say I was a great marketer.
No, I wasn't. Not what I was looking for.
I'm probably even a better engineer than I am a business person.
Well, no, I really appreciate that statement because there are many times where I've been on stage or in shows or in trainings and I say, by a show of hands, how many of you don't know what you don't know? Is it fair to say that somebody knows what you don't know? Is it even possible I might know what you don't know? And the reality is, I think it's one of the reasons I wanted to do the show, and I want to do actually multiple shows because these are the kind of things that when you find out, at least for me, I want to help this is how I help my friends. I might not be the guy that can execute the program or do anything or need that, but I got plenty of friends that do. And that's what friends do for each other, right? Is they let them know about things that are this good, because everything that I've seen about the organization and everything you're saying makes so much sense. And I really think it comes to lack of knowledge on the part of the public.
Another thing too is for years, we want to do the healthcare. Let me back up. We want to do the healthcare. We love healthcare and caring for people and solving at an individual level. We have such a heart for this in our company. What we've done for years is we try to pair up with the risk pools. They could be cost shares. It could be a fixed indemnity insurance company. It could be a stop loss insurance company. It could be a major med insurance company.
Yeah.
And there are always obstacles because the payers of healthcare, they really like to be in charge of healthcare. Now, I don't really like that. I like the payers to give us the rules and the policies, but let the doctors do the work with the people, and then we'll keep the costs down and we'll make sure the right costs happen and the right care happens. And then the insurance company just be there to pay if something gets too expensive. But the things that are inexpensive and frequent, stay out of it. Don't try to pay for the stuff that's low cost and high volume, because you're just going to drive up the cost, right? So just like a car insurance company, I don't want my car insurance company to pay for my gas. I don't want them to pay for me when I run out of gas. I don't want them to pay for my windshield wipers. I don't want them to pay for when I need my tires rotated, because that $100 tire rotation, whatever, I don't even know what it costs, but it's going to cost, that $40 tank of gas is going to cost $300 if I have insurance companies pay for it, because of all the necessary administration to manage it. So we really put the payers, the risk pools, whoever they are, at the end of the journey. We don't put them at the beginning. We don't let them have any decision-making capability in our system. We didn't design them out of the system. We just designed a different role for them and a different place for them. When we designed the firewalls, so the payers, the risk pools, they stay in their lane. And it's only been, and that's clunky sometimes. And they change their mind sometimes. Sometimes eliminating unnecessary activity and spending also eliminates somebody's revenue.
Yeah.
Purchasers and users love it. Sometimes those insurance companies, those risk pools don't like it when you eliminate their relevancy or their income somewhat. So the biggest thing that we've done so far for our company, where there's been recently, has been we created that mutual insurance company so that we don't have to ask other insurance companies or other risk pools or other medical cost shares. We don't have to ask them for permission. Now, it doesn't mean we don't work with them. We still do. But when we work with somebody else who has control of the money, they really get to make the decisions. Just know that in healthcare, whoever has the money makes the decisions. Your doctor does not have the money. So if you're with a big insurance company, your doctor's not making the decisions. Don't even fool yourself. We wanted to create a situation where, though we don't own the mutual insurance company, I had no desire to own an insurance company, but I wanted to create the rules for an insurance company and make sure the incentives are aligned with the purchaser and user, the employer and the employee, and us to take care of them. I had to create my own. And we just did that at the beginning of this year. So as much as I say I'm not a great marketer, I don't think I am, but I understand marketing really well. And I also understand how important having a great product is and listening to the market is. I've got a strategic thinking coach for years now. His name is Dan Sullivan. And one of the things that he's just drilled into me for the last 15 years at least is that the market, your customers, are always 50% partner, and you better be listening to them. And so I didn't want to create an insurance company, but my market, my customer said, well, I don't want to work with that one. You better figure this problem out. And when we figure that, I think we have figured that problem out now with the mutual insurance company, which is an insurance company that the policy for the benefits of the policyholder. The thing I didn't want is I didn't know that was even possible until about 10 months ago. I didn't even know that it was possible to have an insurance company for the benefit of the policyholders. It was a weird concept. But I hired the right people, the right who's, a consultant that's helped us, and I started understanding new capabilities out there. And so we built this mutual insurance company. Because of that, we now become a better option for people who have traditionally used traditional healthcare insurance.
Well, and I think it's, just at the right time, right? Just in the nick of time that you've come with a better option that, quite frankly, for me as a presenter, I think it's an educational opportunity, because I think people are so sick and tired of the system. And as we don't have a healthcare system, we've got a sick care system, and not even a really good one at that, that many times we're fighting with. And so you've created something here that, quite frankly, more people need to know about. At least they can make an informed decision. They can start to look at something and say, hey, this is craziness over here. It's not working. I mean, just the fact that, and you and I talked about it a little bit with my dog. My dog is on a seizure medication that I've gone anywhere from $148 to $34 for the same. Wait a second, it's the same stuff. How can that be that different?
Yeah.
And
Don't
so,
be surprised if you can get that for $10 if you
well,
order it the right way.
well, we're
And
gonna,
let me just tell you a little trick that we use that anybody can use is you might find that, let's say you need 10 milligrams of medication a day. Well, you might find that if you buy 30 days worth of 10 milligrams, the cost is $100. But you might find that if you were to buy 30 days of 20 milligrams, the cost is $105. If you were to cut your pills in half and just take half a pill a day, you essentially lowered your costs in half for the same thing. So that kind of basic math and strategy, you need collaboration with your doctor, because you don't know what the price is. You don't know, the doctor knows what dosage you need, and the pharmacy knows what the price is, but no one's out there on your behalf of going, okay, we need 10 milligrams. What are the different ways we can get 10 milligrams of this pill in Scott's body? We could get 20, cut it in half, or maybe we can do 5 and take 2 of them. That's another trick. And the prices are goofy. And I've seen it where somebody can save $500 a month. It happens all the time. But more commonly, it's probably you're saving $50 a month just by either getting a prescription for half the dose and doubling it up, or getting a dose for double the dose and cutting in half. That's just one of several tricks. Is it a trick? I don't know. That's a bad word. You know what I mean? It's just,
well, I think it's a piece of knowledge. It's utilizing knowledge and saying there's a better way. Again, that's where I think we get to the point where when people get sick and tired of being sick and tired, right? You get to the point where it's craziness. You got to take it. You got to do the things that you have to do for your health to better. But I mean, I don't even know the word, the pressure of the expense to even get the health care to begin with is so crazy.
Hey, I knew that if I didn't get rid of the cost, there's no free up money. I had to free up the money that I was spending.
I think that's a great way of saying it.
Actually, I had to do. I had to free up the money. And a lot of people talk about annual recurring revenue. I like annual recurring savings. So think of that statin for an example. We saved $168 a month every month going forward. That's monthly recurring savings. Now, all of that goes to the bottom line. Monthly recurring revenue, not all of it goes to the bottom line. So I've never heard that concept before, but monthly recurring savings is really attractive to us and to our clients and to the users of our system. And we're always looking for the monthly recurring savings opportunities. And there are many of them. And we get jazzed on, we get excited. We turned it into a bit of a sport behind the scenes. We make a big deal. If we can get a Band-Aid from $10 in a hospital down to $4 in the hospital, or even better, we can get the family to bring one in and put it on you before the doc comes in. And now you get your 10-cent battery or Band-Aid. So we turn it into sport a little bit, and never in a dangerous way, always but we're on mission. And our goal is that we're going to stay under $400 with it and with this benefit or even more benefit for years. And we're at $379 right now. So I built myself a little buffer, and I'm learning about the mutual insurance company business. I'm learning about the TPA business. I'm having fun with it. But at the end of the day, I still like taking care of people. So I enjoy that I can take that knowledge and translate it back to how do we take care of people. That's a really big point for our company.
Well, that's what it certainly comes to. So we're going to do more shows on this because people need to know. So we're going to get the word out and need to help people understand what's possible. So Dr. David Berg, appreciate you being here today. All of you, thank you for joining us here on Scott Schilling Speaks. I'm Scott Schilling, and we'll see you again tomorrow, same time. God bless.